Hi everybody on Instagram, and we're just going live here on YouTube as well. Thanks for joining me for this webinar. And in this webinar, we're going to talk about discovering effective strategies for managing back and spine pain. This is a very popular topic because a lot of people do have spine and back pain, and they want to know what they can do to help it. You know, what they can do themselves and how chiropractic can help them. And that's something I wanted to go over today. So let's get right into the slides here. And if you guys have any questions, please, you can type them in the comment section here on Instagram or in the chat on YouTube. I will get to questions and answers after a few slides, so I will check those periodically. My name's Dr. Cary Yurkiw. I'm a chiropractor in Kelowna, and I've been practicing chiropractic now for 30 years. And I've seen so many people with back and spine pain over the years, thousands of patients with this condition. And our treatment has been very effective to help people. Now, there's different reasons for the back and spine pain, which we're going to get into today. But chiropractic in general is very effective for these conditions. I come from Winnipeg. I went to school at the University of Winnipeg, and then I went to Toronto to study chiropractic. I practiced the first 15 years in Winnipeg, right on Portage Avenue, next to the old CGOB, Portage and Arlington, at Power 97. And then I moved to the Okanagan in 2008, had a clinic in Penticton for 10 years, and now I've been in Kelowna for 5 years. So it's been a wonderful career, and I just seem like, I'm still very interested in learning. I'm very interested in new technologies. We do have shockwave and laser here in the clinic. So it's been great to integrate some of the newer technologies and some of the newer research into my practice over the years. And I plan on continuing to do that as my career progresses. Now, what are you going to learn today here at this webinar? We want to talk about the causes of low back pain. We want to talk about effective treatments, and we want to talk about the importance of early diagnosis. Now, when someone has pain, let's say they had an injury, what I recommend is they come in as soon as possible to get checked, because if you wait, it can get worse. And sometimes these old injuries turn into chronic problems where the person has this long-lasting pain and pattern, and it's harder to correct the spine once something's been there for a long time. It takes longer. The chances of a full recovery go down as the years go on. So it's better to get assessed as soon as you have an injury or a car accident, anything like that, while the injury is still kind of fresh, and then we can do something about it and do it quicker and more effectively. In this slide, I want to talk about managing sciatica and the common causes of sciatica, what we can do to help with sciatica, and the latest treatment options. So sciatica is defined as pain in the low back. It can travel down into the buttock area. I've seen it where it's traveling down both legs, and it can go all the way to the tips of your toes. So sometimes it causes pain in the ankle area, which right now actually I have a patient that has sciatica and pain mostly in the ankle area. Sometimes it causes numbness and tingling going right down to the foot. Sometimes there's a pain right in the buttock area, and usually it's a deeper type of pain, like kind of deep in the joint or the muscles, and then a pain going across the back, a sharp pain right where the spine and the hips meet. Those are common areas for sciatica. And we want to talk about what we can do to help with sciatica. Usually that involves adjustments to the lower part of the spine and the sacrum. There's two joints on either side of the sacrum called the sacroiliac joints. Adjusting those sacroiliac joints can really help with conditions like sciatica. And then giving the patient some stretches and exercises, talking about their ergonomics, the way they sit at their desk, the way they do their job, the way they sleep, and then giving the patient some strengthening exercises to do as the alignment and the function improves, usually is a very good recipe for success. Now, sometimes I'll add in shockwave, which are sound waves to break down scar tissue, or laser therapy, which is light, concentrated light that goes into the body to speed up the healing process, reduce inflammation, release good chemicals. Sometimes I'll use that in combination with the chiropractic treatment. Some people need a little bit of extra help, so what I'll do for them is some health coaching, where I'll give them some stretches and exercises and then meet with them on a weekly basis to see how they're progressing with that, either in the clinic or using technology like Zoom. And then sometimes we do orthotics and custom orthopedic shoes that help cushion when you're walking, help correct for misalignments of the feet, which can really help with the alignment of the hips, especially if there's something like a short leg. Now, we're going to talk about degenerative disc disease here. Now, the discs are like jelly donuts in between the bones. And when we have misalignments in the spine or an injury, it can cause these jelly donuts to break down. And they're the first things to change when we look at an x-ray or there's an MRI or a CAT scan. We see that the disc space is narrow. And when the disc space is narrow, the nerves are coming out between the bones, they can get pinched. This can contribute to back and spinal pain conditions like sciatica. So we want to effectively cope with degenerative disc disease by using some practical strategies for management, enhancing spinal health, and then long-term care tips to help with with coping with the pain and the recovery. Here's a few tips that I give patients that have degenerative disc disease. One is exercise regularly. And I know it sounds counterintuitive, but when you exercise on a regular basis, it tends to mobilize the joints. It gets you moving. When you move, the nutrition and the fluid circulation in the joint is better. The movement receptors, we call those mechanoreceptors, they block the pain receptors, the nociceptors, so it can really reduce pain when you're moving as well. And then, of course, maintaining a healthy lifestyle. Some of those healthy choices can involve nutrition, like protein, like healthy fats, like nutrient-dense foods, or even taking supplements. One of the supplements I took out today is called Nutriflex. And this Nutriflex supplement, I'm just going to turn on my camera here on YouTube for you guys. This Nutriflex supplement is a supplement that's made by NACA. I really like this brand because they do such a good job of holistic ingredients. And in this supplement, you have glucosamine, you have collagen for the connective tissue, MSM, turmeric as an anti-inflammatory, devil's claw, bromelain, boswellia, and vitamin D. All very important components of a nutritional supplement for the joints. So we do carry that in the clinic. We carry other types of products to help with joint recovery, as well as the ergonomics of the spine as well. Now, what are some of the latest treatment options that we offer? Earlier, I was alluding to the fact that we have newer technology. So one of them is shockwave right here at the top. Shockwave is something that you can feel when we do it. There's a tapping right on the spot. That tapping usually feels really good. And there's a graphite bullet that kind of circulates through this tube. And when it hits the head, it produces a sound wave. That sound wave goes into the body, into this tissue in the joint, breaks down calcium deposits, scar tissue, and brings in blood flow and nutrition into the joint. So shockwave, very effective in helping conditions like back and spine pain. Also, I use laser therapy. Laser therapy is light, concentrated light that goes into the body in two wavelengths, 600 and 900 nanometers, and those wavelengths will help stimulate the mitochondria and heal the tissue. We also use different techniques in the clinic. Here I'm showing traction or decompression therapy using the Y-strap. And We use traction to open up the spaces between the bones, allowing the discs to have more room so that they can repair and heal better. But also I use hands-on adjustments, instrument adjustments, tables like drop table or Thompson technique. There's a number of different techniques we use to realign and improve the function of the spine and the healing process. So we use a number of different techniques, and then I was talking about health coaching a couple slides ago, just some extra time to teach people how to take better care of themselves. And then some accountability. If you meet with a coach on a weekly basis, you're going to be accountable to some of the recommendations the coach made. And I find the health coaching here in the clinic to be a very effective way of empowering people and establishing new routines, healthier habits compared to the old ways that they're used to doing things. Now, I do give out targeted exercises, and some of these targeted exercises are to strengthen your back. And initially, I might start with something simple like the cat and dog, which I'll show you in a minute, or thread the needle, these kind of yoga postures, which are very good. But then we want to progress into planks, side planks, bridges, different strengthening exercises for the core to help maintain proper alignment and flexibility. This will help reduce pain. It'll maintain the changes that we're making in the clinic, and you'll progress faster and better than if you're not doing these stretches at home. So let's talk about these. I've got a few for you today that you can follow. This is the cat and the dog, or the cat and the cow, and this is where you arch your back towards the ceiling, your head goes down, you're just stretching the extensor ligaments, muscles, and discs on the back part of the spine on this one. Very effective in producing better flexion of the spine. And then I tell people to alternate, go into this position, which is the opposite. You're extending your neck backwards, your belly kind of sags down to the ground, and your head goes up, stretching the ligaments and discs on the front part of the spine. And we call this extension. So it helps with the extension of the spine. Depending on your condition, if it's a disc condition that you have, it might be more challenging to do this one at the top, the flexion. If it's more of a facet or a pinched nerve, this one might be more difficult for you. And that's why it's important to give the specific stretches for that individual condition. So these are just general stretches that I give patients that I'm sharing with you, but depending on the patient's condition, we usually give a specific stretch for them to do at home. This is the pelvic tilt. And what you do is you push down into the ground, just get everything flat, including your lumbar spine. That'll help with the flexibility and strengthening, and then lifting your hips off the ground. This curl action helps to strengthen the flexors of the hips, stretching the extensor of the low back. So I like to give this exercise in the clinic just to help with the mobility of the lumbar and sacral joints. And then this one, the bird dog, I like this one because you're extending one arm and then the opposite leg, and you're holding yourself on all fours on the ground. And this is good for core strengthening and also coordination. And that's very important as you heal from a low back spinal condition. We want to get that strength in the core, and then also the stability or the strength for you to shift positions, to move quickly in different types of positions. So that core stability is very important. And I like this bird dog exercise for that. And generally, I tell people to do exercises first thing in the morning and just before bed. That's a good time to do it. And I'll say do 8 to 10 repetitions in general of each exercise. It takes you 5 or 10 minutes, but it's a really good way to start your day and to wrap it up just before bedtime. And the body's very receptive to doing exercises at these times. Lifestyle modifications. There's some lifestyle changes that you can make that can improve your spinal and back health, and some daily habits to adopt and make changes so that you can have better habits. So Maintaining a healthy diet is one way that you can improve your lifestyle. Eating more protein on a regular basis. I just had some turkey. It was turkey breast that was cut up into slices. So just oven roasted turkey breast, very healthy. I had about 150 grams. You can use an app like I do, Carb Manager, to log in the foods you're eating. And then I had some sweet potatoes with that. So really good nutrition for lunch. Just takes a bit of planning and and then once you get into the routine, you'll be able to do that on a daily and weekly basis, no problem. Practicing good posture, shoulder blades back, head up, and going against the wall is a good measure for you. So if your head's off the wall, shoulders are rounding, then we want to work on getting the shoulders back and the head level. And one of the things I like to give is the wall angel exercises to my patients to do against the wall, putting the arms up overhead and then back down. When you do these wall angels, I'll turn my camera on again on YouTube. When you do the wall angels just like that against the wall, keeping the shoulder blades back, very effective at improving your postural muscles, reminding you to have good posture. And then stress management techniques, very important as well. Breathing techniques like doing meditation, deep breathing, relaxation, very important to manage stress. And of course, dealing with the stressor if possible. Some stressors you can deal with, others you have to just cope or manage. But reducing stress is good because it reduces inflammation, drops your cortisol levels in your body. Generally, it's better for healing of the tissues, because when the tissues have too much cortisol, they can be inflamed and they're sore and tender and not as strong or stable as tissues that don't have as much cortisol or the body that doesn't have as much stress. Now, if you have any questions and answers, I'm going to see if I can get over here to YouTube to my control panel. So just bear with me. It might change our slide here on YouTube. Let me see what I can do here. Yeah, here we are. So I'm going to put this slide over here. Hopefully that looks okay to you. And then I'm going to just check the chat right here. If you have any questions, feel free to ask them here. And then on Instagram, I'm going to stand up because I can't see the bottom of the screen. If you guys have any questions, feel free to ask them here on Instagram. You can type them in the comments and I'd be happy to answer those questions for you. So today we were talking about effective strategies for managing back and spine pain, something we see all the time in the clinic. I am going to do a masterclass coming up on Wednesday. I'm going to tell you about that and I'm going to show you how to get tickets. But before I move on, I just want to know if you have any questions. I will put a link to the masterclass here in the chat on YouTube. I'll see if I can add a link later to Instagram if you want to get a ticket, or you can go to the link in the bio and then our Eventbrite page, and there you can get tickets there for the masterclass coming up on Wednesday. I want to remind you to follow us. Our website, I'll show you that in a second, is tutstreetfamilychiropractic.com. We're on Eventbrite. All of our events are listed on Eventbrite. We have a newsletter you can sign up for. We send that out every 2 weeks. You can become a patient in the clinic. We are accepting new patients without a doctor referral. You just have to click on the link in the bio on Instagram or here in the description on YouTube. So very easy to do. And if you're interested in health coaching, either in the clinic or if you don't live in the area, like you're outside of Kelowna and you want some help, I'd be happy to do health coaching. I do have a consulting company called True North that offers health coaching. We can definitely help you by talking about your specific condition, referring you to a chiropractor in your area, and then just helping you to be the quarterback to get the right type of care for your condition and coordinating some stretches and exercises, things you can do in conjunction with the care you're receiving. Now here's our masterclass coming up in 2 days on Eventbrite. I am going to just switch over to my Eventbrite slide. Let's see if we can do this pretty easily. So here's my Eventbrite slide. I'm just going to make it a little bit bigger as well. There we go. So this is my Eventbrite slide and my clinic website right here. And this is the masterclass coming up in 2 days. So for the masterclass, you can get tickets by going to Eventbrite right here. I'm going to copy this link and just put it in the chat in a second on YouTube. And so you can get a ticket for this masterclass coming up. It's going to be on Wednesday at 12 noon. And there is a fee for this, but it gives you the opportunity to talk about your specific condition. And we're going to get more into detail about stretches and exercises that you should be doing at home. So we're going to dive deeper into this concept, give you more homework to do, talk about your specific condition. And then I'll have an offer for you to take advantage of some health coaching or your first visit at our clinic at that masterclass. So you'll get a discount to come into the clinic if you'd like to, or get some health coaching. So that's the Eventbrite masterclass. If you want to book an appointment in our clinic, this is the link right here. If you go to our website, touchstreetfamilychiropractic.com, and click on the homepage right here, and then book now, that'll take you to our booking site where you can book an initial office visit in the clinic. Very easy to do. Couple steps: enter your first name, last name, your email, and your mobile number. Pick a day and time. Usually it's the same or the next day you can get in. And then we're going to text you some paperwork to do. You can click on the link, fill out the paperwork. Very easy. So that's how you can book an appointment. Now I'm going to go back to my slideshow right here and just finish off with our contact information. Okay, so our contact information here at the clinic is right here for you. So we are located at 406-2755 Tut Street. That's at the corner of Tut and Raymer and in Kelowna. And if you go to our website, tutstreetfamilychiropractic.com, you can get more information about our upcoming events, our blog posts, which we do a few times a week. And you can also book an appointment that way as well. If you have any questions, you can email us at info@tutstreetfamilychiropractic.com, or you can call or message us at 250-486-0062. We'd be happy to answer your questions, book an appointment for you, just make it easy for you. So that's our contact information. I hope to see you guys at the masterclass on Wednesday. You can also join us for some free webinars coming up in the month of June. If you go to our Eventbrite page, you're going to see those free webinars coming up. And of course, in the clinic, we're here all this week, including the weekends, Saturdays and Sundays. Very convenient schedule for you to book appointments. So there are some openings. We try to keep one opening each day for a new patient. Somebody who has an emergency. So there should be some openings for you